What hormones impact how well you can build muscle? This is a question I get all the time because a lot of times we just think that my muscles are there and they will grow because I'm eating protein. Sure, yes, but your hormones actually have a big impact on your body's ability to grow and maintain your muscles. And one of the main things that I hear from a lot of women when they are really struggling with their hormonal health, struggling with weight gain, weight loss resistance, things like that, is that when I ask them about their progress and things that have occurred in the past few years for them, they'll say, yeah, I work out this many days a week, or I have a trainer, I do this class or something like that. And I'll ask about it. Okay, well, how's that going? Oh, it's fine. Oh, okay, but are you actually getting stronger? If you're lifting weights, are you getting stronger? Can you feel that muscle response? And a lot of times the answer is actually no. And they won't even have realized it. Yeah, I'm actually, wow, yeah. My last set of lifting, I can't even finish it, or I don't even do, the same weight as I did when I started. That's a big deal. Or if you do push yourself too hard, you're sore for days afterwards. Also not normal, meaning your muscles don't repair and rebuild at the same rate. Now, getting protein in is very helpful and essential, and I talk more about, protein pacing and things like that in my book, The Female Fat Solution, and my book, The Female Menopause Solution. I also have episodes on this on my podcast, The Female Health Solution. So you can subscribe, make sure you're subscribing to all the things to stay updated with that. But besides just eating protein, the other thing to keep in mind is that your hormones play a role in how well you can actually maintain your muscle growth. Your hormones. Well, a main one is growth hormone, right? Growth hormone for the human body, especially an adult, is most active actually between 10 p.m. and 2 a.m. So not something that would be going on during the day, but if you're having trouble sleeping, that can play a big role in how well your body and muscles can recover. The next hormones in line are testosterone, and this is really the main one for males, right? Testosterone also plays a role for the female body, but for females, it's actually estrogen levels. And if you are struggling with your hormones overall and have issues with your estrogen, that can impact how well your body can repair and maintain that muscle. Yeah. After that, you'd be looking at insulin, glucagon, adrenalines, those play a role, as well as your thyroid hormone, right? These all play a role also. But we forget a lot of the time too that cortisol has an impact on your body's ability to build and maintain lean muscle. Yes, right? So if you are trying to work out really hard and you're like, maybe I'm not building muscle and maybe I'm not burning fat, maybe I'm not working out hard enough. I'm going to work out harder. And you push your body harder and you go after things harder. Oh, okay, great. But if you're causing your body to increase in a stress response, it's actually going to work against you because your system isn't going to be allowed to have that muscle repair happen. That also can throw off your estrogen levels and it can impact your ability to sleep and rest, which is going to impact your body's ability to have that growth hormone kick in as well. There's a lot of different complex things that are involved with building and maintaining lean muscle. And your lean muscle is a big factor in how your basal metabolic rate functions. Muscle is hungry. Muscle uses a lot of energy to function, right? So one of the base things for overall metabolism is to make sure you have enough lean muscle. And it's not just eating protein that does that. It's really working with your hormones in your body. So if you want to work more on this, if you want to dive into this more, make sure you are on the waitlist for the next Female Hormone Solution program. We are going to dive into this. I teach you exactly how to do this, and we do a hormone test, a Dutch test, to see what your hormone levels are so we can make sure that we are addressing any imbalances, any issues there, so that gives your body the best ability to build and maintain your lean muscle and improve your metabolism. So if you have any other questions, please don't hesitate to reach out, but I can't wait to see what your hormone levels are and make sure that your body is able to build lean muscle and keep it.